My name is Shelley. My name is Shelley Pigott from the Power of Nutrition, and this webinar is an occasion for the Power of Nutrition to celebrate our 10-year anniversary with all of you and with an expert panel made up of some of our partners that we've worked with across 10 years. To mark our anniversary, we have worked on an impact and learning series to take a really deep dive into the lessons that we have learned over a decade, the impact that we've had, the challenges we've faced in our mission to improve nutrition for women, adolescents and children. And that's right across Africa and Asia. Our aim is that these insights might better support the sector as we push forward to the SDGs and global nutrition targets. We've had a number of research pieces that have been produced as part of our series, particularly our impact reports, and we'll cover some of that today. And just to give you a bit of context of this webinar, we're going to kick it off with my colleague Alok Ranjan, who will introduce himself in just a moment. He's our Director of Programs and Investments, and Alok's just going to share some key insights from our impact report. And then we'll, after that presentation, we'll move on to our panel discussion with our fantastic guests, who are not only nutrition experts, we're delighted to have with us, but also long-standing valued partners of the Power of Nutrition. Partnerships are at the very core of what we do, and the results we accomplished over the last 10 years are only possible thanks to those partners. And together with the panellists, we'll discuss the results, the lessons learned from the partnerships, and the programs we've been running together. Also, we'll explore the path forward for improving global nutrition outcomes with some recommendations towards the end. Before we start, I'd just like to remind you that the webinar is being recorded today. The video will be available in a few days on our website and via digital channels. And we have a chat function open on this webinar. We're not sure that we're going to get time for questions today, but please do share where you're from. We'd love to see where you're dialing in from. Share any thoughts and comments. We'd love to pick those up afterwards. And all the links to the reports and our publications will be shared in the chat. They're all available online, and more will be released in the coming months. So what I'd love to do is just take this moment to bring that slide back up again and introduce you to our wonderful panel that we have with us today. So firstly, my co-moderator here and colleague, Dr. Alok Ranjan, our Director of Programs and Investments from the Power of Nutrition. Natalie Roschnik, our Senior Nutrition Advisor from Save the Children. Lisa Shireen Saldanha, Senior Nutrition Specialist from the World Bank. Terri Sarch, the Head of Nutrition for Foreign, Commonwealth and Development Office in the UK Government. Dr. Sisay Sinamu, Senior Programme Manager with the Sakota Declaration, the Federal Programme Delivery Unit in the Ethiopia Ministry of Health. And Hannah Tasic, Research Manager with Modern Scientists Global. So welcome to all of you, and thank you so much for taking the time to join us today. And now I'm going to pass over to my colleague Alok, who's just going to go through some of the key highlights of what we've learned over the last 10 years. Alok.
Thanks, Shelley, and welcome everyone, all the panelists, as well as all the audience that we have for this webinar today. We are really very happy, very proud to be sharing along with all our partners the journey of the last 10 years. So we at the Power of Nutrition have a vision of a world where every child has the right nutrition to achieve their full potential. And we started this journey exactly 10 years ago. We came out of the first Nutrition for Growth Summit and were established as an organization in 2015. And since then, the partnership has evolved with multiple insights, multiple learning, and that's what we want to bring out in the session today with different stakeholders that we have. This slide you'll see is a glimpse of the snapshot of the key highlights. When we started, we had 3 funding partners: SIF, DFID, now CDO, and we had UBS Optimus Foundation, and we had 2 founding implementing partners, the World Bank and UNICEF. And you see here, the first circle, it talks about the 50+ partners. So that's how the partnership has evolved over the last 10 years, with multiple funding partners being added, multiple implementing partners being added as we went on this journey. And over a period of 10 years, the number of investments, the partnerships that we have is now 26, And this is spread across 17 countries. 13 of those are in Africa, and 4 of those countries are in Asia. So that's the breadth of the geography where we are spread. In terms of what is the portfolio like, the portfolio, which is comprised of these 26 programs, it is has a total value in terms of funding of approximately 647 million US dollar, includes our platform funding, the funding that we raised, and the funding that we leveraged with our domestic resources, concession loan, as well as other implementing partners matching funding. And this has all led us to reach women, children, and adolescents across these 17 countries. And the number of women, children, and adolescents that we have been able to reach over the last 10 years is 180 million. So we did with MSG, and Hannah is here. So MSG and team, we looked at the interventions, the coverage levels, and we used the list modeling tool to give us some of the insights in terms of what is the kind of impact all this work has done. So we have reached more than 11,000 neonatal deaths has been averted. We have been able to avert deaths of approximately 46,000 children. In terms of number of anemia cases that has been averted, it is over 780,000. And in terms of stunting stunting years that has been averted, it is more than 429,000. We had 2 additional insights coming out of this list analysis that MSG did along with John Hopkins, which were in terms of the additional life earning due to decreased stunting. And this was a number which came to around 260 million US dollar. And the second is in terms of the additional years of formal education completed by a birth cohort, and this was around 57,000. We're very happy with kind of the sort of insights. It is not just giving us stunting reduction, but it is also giving us in terms of other things that we wanted to target and achieve. 2 things I would want to call out here is there are limitations in terms of a number of multi-sectoral interventions that we have been partnering and doing, which doesn't get captured in the list modeling, and those insights could not be translated in terms of the impact number. Also in terms of a lot of work, especially with World Bank and UNICEF and various INGO partners that we work is around the health system strengthening, and a lot of those things cannot be quantified in terms of the impact number that we have here on screen. But overall, this is in snapshot the impact number of the last 10 years of work. And on the next slide, then we'll talk about the geographical reach. And you see the spread here, as I said, 13 countries across Africa, 4 countries across Asia. That is where our 180 million women, children, and adolescents that we are reaching with our partnerships with different funders and implemented through various implementing partners on ground. Next slide, please. Just a quick overview in terms of how it has increased over the years. As you see, very early on, we had very few programs. 3 programs started around 2016, and then we had the reach numbers. And initial part, you will see it's mostly around the first 1,000 days that we were prioritizing. But as you see, going ahead, we expanded our interventions, becoming more and more multi-sectoral, at the same time expanding it beyond the first 1,000 days as a age group that we were targeting as well. And the last circle that you see on the right-hand side, it's a reflection in terms of funding, where almost 25% was the platform fund. Then the funding raised with the private and bilaterals contribute around 14%, and 61% is the co-financing, which includes domestic resource allocation, which includes the concession loan and the match funding coming from the implementing partners as well. Next, please. And we, as a Power of Nutrition, work in tandem across fundraising and programs. So it goes hand in hand. And you saw some of the programming reach numbers and impact numbers. And in terms of the fundraising, we are pretty excited to talk about almost 72% of the total donor funding that we raised. And this number is as up to 2023 is from the private sector contribution angle. And very happy to also report that 29% of the total donor contribution that we have had in this time period is from new funders to nutrition. And that's something that we have always been thriving to focus on. In terms of the average leverage rate, the $4 that you see, this is like for every platform funding dollar, the Power of Nutrition were able to generate $4 of additional financing. That's the kind of leverage that we got with the platform funding. In terms of the program leverage rate, this is for every dollar spent on operational program cost. Roughly around $49.50 was used for the programming activity. So that brings in the efficiency in terms of the delivery as well. And last but not the least, in terms of $5.16 was raised per dollar, which was spent on fundraising. So these are the kind of insights that we have from our high-level insights across our programs and our partnerships and the fundraising aspects. Next slide, please. So this brings us to the next set of discussion that we're going to have on the webinar today with all our panelists. And when we reviewed our last 10-year, all the activities, everything was kind of coming across 3 pillars for us. And that's what came out in the endline evaluation as well. And that's what most of our discussions of the panel discussion today is structured around. So first is the catalytic financing to increase impact, scale, and sustainability. This was a big chunk of why the Power of Nutrition was created as an entity. Second pillar is for us championing partnership to achieve transformative changes. And that is what we do. Every program, every investment is a partnership across national government, the funding partners, multiple funding partners, and multiple implementing partners. And last but not the least, the important pillar of the multi-sectoral approaches, because we know addressing nutrition has to be dealt with from a multi-sectoral approach. So back to Shelley as we start the panel discussion.
Brilliant. Thank you so much, Alok, for that insight into our 10 years. And of course, they're really big numbers, but as we all know, every single individual that we have been able to make a difference for is key to us. So we'd like to continue the webinar with a conversation with our panelists around those 3 thematic pillars that Alok just mentioned there. And our first speaker is Terri Sarch, the Head of Nutrition with the Foreign, Commonwealth and Development Office within the UK government. I'm delighted to have Terri with us. And from what I understand, Terri, you trained as an agricultural economist and completed a PhD in 1999. Terri took up her role as nutrition team leader in the United Kingdom's Foreign, Commonwealth and Development Office in November of 2021, having originally joined DFID in 2005. And in her current role, Terri leads FCDO's approach to addressing global malnutrition, both effectively and sustainably. I know Terri will build on her experience as ambassador and permanent representative to the UN Food and Agriculture Agencies in Rome from 2016 to 2021 as well, where she represented the UK in a number of governing bodies. Terri, thank you so much for joining us. FCDO was one of the Power of Nutrition's founding partners, one of the 3 Alok mentioned there, and provided matched funding to the Power of Nutrition, which has been really the bedrock of so much that we have been able to achieve in the last 10 years. Those platform funds have enabled us to really catalyse further funding to the amounts Alok was just talking about. We'd love to just hear your thoughts, Terri, a little bit more about how you've seen matched funding mechanisms deliver impact at scale, and why you think investors should look to pool or match resources for maximum impact.
Right, well, thank you, Shelley, and thank you to everyone at the Power of Nutrition for inviting me to speak today. As you're celebrating 10 years of the Power of Nutrition, 10 years is a really significant milestone, and in some senses it seems like a really long time given how much has happened since 2015, but in others it seems like just a blink of an eye. In any event, I've been part of that journey with you only really since 2022, so I'm only a small part of it, so I'm particularly honoured that you've asked me to speak today. But as you know, and as Alok and you, Shelley, have both said, FCDO has been a sort of founding partner for the Power of Nutrition, and we ended our funding to the Power of Nutrition in 2020, early 2023. But we are still very committed to the fight to end malnutrition. And, just as the Power of Nutrition and many of us in the nutrition community have struggled with funding, so we have done in FCDO with ODA cuts. But nonetheless, we are still committed to ending malnutrition, and you will have seen that at the most recent Nutrition for Growth Summit, where our Minister for Development, Baroness Chapman, was there. She launched our Global Compact for Nutrition Integration, and I think I'm going to get to speak about that in a little bit later, so I won't say too much about that now. But you have asked me about match funding, and I would say that it has worked, but it's very challenging. The UK committed to providing match funding with the Power of Nutrition, and I think we had agreed that we would match fund all the funding that Power of Nutrition could raise from new donors, i.e. donors that hadn't traditionally given to nutrition. And we contributed £55 million, and that raised about $80 million from new donors. And that's an important achievement. But sadly, it didn't meet the target that we'd agreed on. And that was very frustrating. And so I would say that, match funding has been successful, it has worked, but it comes with challenges. And of course, I think I'll sort of set out two challenges. One is, it's not immune, match funding, despite the challenges that we're all facing with cuts to ODA budgets right across the world. Match funding isn't immune to that. It's not a solution to that problem. And of course, administratively, it's very difficult to administer. And I guess I would say that as I'm a civil servant, but it's very complicated. And we learned lots of lessons about how to do it and how not to do it. So I think we know a lot more now, 10 years on, than we did in 2015. But that's not to take away from the fact that it did work. It did bring in new money, new funding from new donors to the work of the Power of Nutrition. And of course, that money really delivered some really important results. And of course, the sort of overarching result when we completed our funding was that the Power of Nutrition, together with your partners, had contributing to reaching a lot of women, children and adolescents with nutrition services. And that's a really important result. So overall, just to sort of summarize and hand it back to you, I think, yes, it works, but it is challenging and it's not immune from our sort of the really tough global context that we're in today. Back over to you, Shelley. Thanks.
Thanks so much, Terri. Yes, it's not immune, and very much part of this learning series was wanting to make sure that we dug deep into the things that had worked and didn't. The whole point is being able to build on our learning for the benefit of the wider sector. But over to Alok, who's going to introduce our next panelist.
Thanks, Shireen. And thanks, Terri, as well. So I'll invite Lisa now. So Lisa is from the World Bank, and she's a public health and nutrition specialist with over 15 years of experience in policy, analytics, and operations in large-scale health and nutrition program. Her work at World Bank focuses on integrated systems-based approaches to strengthen service delivery and improve outcome at scale, particularly in sub-Saharan Africa. And we're very happy to also say that our partnership with the World Bank has been almost as long as Lisa has been with this partnership, designing all the initial programs and all the initial partnerships that we started with the World Bank. So welcome, Lisa, for this 10-year celebratory webinar that we're having. So I have two questions. I'll ask the first question, which is about how the Power of Nutrition and the World Bank partnership over the last 10 years contributed to increased prioritization of nutrition, both within World Bank, but more so at the country level as well.
Thanks, Alok. As you said, I've been working with this trust fund at the World Bank, the Power of Nutrition's trust fund at the World Bank for since 2016, and so it's been very interesting to watch this journey. I wanted to kind of reflect a little bit about the kind of the core model and how it worked at the World Bank, because I think that this issue around matching that Terri's mentioned I think actually the Power of Nutrition's contributions and the match in this context at the World Bank worked really well, because I think for every dollar in new nutrition financing that the Power of Nutrition could bring to the World Bank, recipient governments then had to match it with at least an equal amount of their own IDA financing. That's the concessional resources that they receive through the World Bank, which, typically I think had been more maybe in this sector focused on health or agriculture, social protection sectors, which are essential to nutrition, but maybe hadn't included nutrition. And so actually the one-to-one match went far beyond what had been planned. I think the Power of Nutrition mobilized around 104 million in grant financing. That leveraged over 280 million in IDA investments in nutrition and human capital development. During this time, obviously, the World Bank's nutrition investments really increased from about 870 million in 2017 to 2-something billion by 2023. And I think it's really worth noting how the Power of Nutrition investments maybe helped to keep the focus on high impact, evidence-based interventions, working with sectors that maybe hadn't previously had nutrition in them, and moving away from siloed nutrition-focused investments to more integrated investments. I think the Power of Nutrition also really enhanced the use of results-based financing, and using countries' own delivery systems, right? So that was, I think, a real plus. I wanted to provide a quick example, which was in Ethiopia. Previously in Ethiopia, the financing had always been, nutrition financing had been standalone, and then health financing was another program. And those programs in the bank were separate. And the Power of Nutrition investment, for the first time, mobilized nutrition within a bigger health investment. And so, for example, when the health investment was incentivizing the government to increase the use of antenatal care, which effectively it did, I think antenatal care visits went from 32% to 43% during the program. The Power of Nutrition investment incentivized the government to make sure iron folic acid was part of that package. So then iron supplementation increased from 42% to 60% in the program in that time. And so that match, that's just an example of, I think, how the match of Power of Nutrition financing was able to use previous existing bank programs, but have a very targeted, highlighted focus on specific nutrition results.
Thanks, Lisa. And thanks for sharing country-specific insights as well here. So my follow-up question then is, so in the current funding scenario globally, a lot of focus is on leveraging the multilateral development banks and the concessional funding. So from this partnership, the World Bank and the Power of Nutrition partnership that we have had, what lessons do you think can be taken to inform other partnerships with other multilateral development banks to increase the utilization of concessional financing for nutrition?
Yeah, thanks, Alok. I think for me, the biggest lesson is that I think longer term engagement is needed with NDBs, because it takes a complex outcome like stunting requires strengthening, transforming systems beyond what can be achieved in the timeline of a single project. And I think when multilateral banks are trying to invest in this kind of change, they need to sort of, I'll just give an example. I think it's easier. Like, for example, in Madagascar, where there had been, at the time that we started this investment with the Power of Nutrition, a real focus on, I think, more humanitarian response. There was also a big focus on undernutrition, less so on stunting and less so on the engagement with other sectors required. And I think the Power of Nutrition investment, with the focus on stunting rather than, I think, underweight, and the focus on a very focused package, allowed the government to have a different discussion. The bank was already engaged on that, but when the Power of Nutrition came in with this very focused approach, I think the government, it brought some new energy and some new donors actually to the table. The government ended up committing to 10 years. This is not just what Power of Nutrition invested in, right? The government ended up committed to 10 years of investment in stunting reduction. And that allowed a planning process over many years, which, you know, the initial Power of Nutrition investment of 10 million was matched, I think, by 100 million of IDA. But then over time that has multiplied, I think went to 200 million, and now there's preparation for further investment. And I think it's not just the money, it was actually the signaling to many, to other partners, also to other sectors within the World Bank, that this was a focus and a priority for the government. And that allowed, over time, agriculture to look for convergences, social protection to have convergences. And so this could not have happened within the time frame of a single operation. And I think we really need to move into a longer term thinking and be a bit more strategic about where we're going over time. Thanks.
That's a very strong message, and something that we kind of see happening, especially in geographies where we have repeat partnerships and repeat investments in the country. It shows the value that you're talking about by being invested in the geography for a longer term. So thank you so much for those insights, Lisa. And as you're talking about leveraging government systems and you're talking about domestic resources, you mentioned about the Ethiopia example, I would like to call upon our next panelist, Dr. Cisse. And Dr. Cisse has been, so he just mentioned before the start of the webinar that there might be some bandwidth issue at his end. So if he is on, if he's coming on camera, great. Otherwise, he might be off camera so that we can at least hear what he's saying without any disruption. So Dr. Cisse has been a Nutrition International technical assistant provider in Ethiopia since 2017, serving as a senior program manager at the Secretary Declaration Federal Program Delivery Unit in the Ethiopia Ministry of Health. He provides technical and administrative leadership for the federal and two regional program delivery units. And Dr. Cisse today will be focusing a bit more from the Ethiopia Nutrition Goals perspective, which is a big part of the Secretary Declaration. And for the Power of Nutrition, it's great to have Dr. Cisse on this webinar, because out of the 26 programs that we talked about across 17 countries, one country, Ethiopia, has 4 of our partnerships. Our first partnership there was with World Bank that Lisa mentioned about. Then we currently have an ongoing partnership with UNICEF and Action Against Hunger implementing the program on ground. And we have multiple funding partners in that. And then we had a new approach, we called it Product Access Initiative with Ethiopia Public Health Institution, which was looking at data, real-time monitoring, and bringing that together with the coverage level aspects on the ground level and engaging the local stakeholders in solving. And there was also an investment looking at the humanitarian and development nexus around nutrition with IMC. But the focus today with Dr. Cisse is because of also what we heard during the Nutrition for Growth Summit. So Dr. Cisse, if you can hear, my first question to you is, so one of the most exciting sessions that Shelley and I were part of during the Nutrition for Growth Summit was the Secretary Declaration session that you anchored, you hosted, and it was amazing to see the buy-in from different donors, different funding partners, and the government ownership, the accountability of what was done over the last 4 years since Tokyo commitment, and what you guys were committing for the future years. So the question is, can you briefly describe for the audience about Secretary Declaration and the importance of partners convening together behind such government vision and strategy? Over to you, Dr. Cisse.
Thank you so much, Dr. Alok, and I would like also to thank the Power of Nutrition for inviting me to be in this panel. Can you hear me?
Yeah, we can hear you.
Okay, thank you so much. Just to give you a brief background on the Secretary Declaration. The Secretary Declaration is the Ethiopian government commitment for ending stunting by the year 2030. This is a 15 years commitment unveiled back in 2015. And we are now, I think it's the same as the Power of Nutrition 10 years. Now this is the 10th years of the Secretary Declaration. We have completed the first phase, which we call it innovation phase, between 2016 and 2020 in 40 high stunting burden waradas in the northern part of Ethiopia, where we have also generated an evidence through learning by doing approach with an average annual rate of reduction of stunting 3%. That has enabled us to make a decision to expand from 40 districts to 240 districts in 2021. Currently, we are on the almost final fourth year of the expansion phase, and the expansion has also been grown from 240 waradas to 334 waradas, and we aim to reach 700 warada districts, 700 districts in the coming 2 years. So the most important part of this is our partnership with a wide range of stakeholders. These are the civil society organizations, the donors, and also like the partners with the Power of Nutrition has been really an enabling for the Sakota Declaration success. Just to mention a few of the activities that we have been doing with the Power of Nutrition, specifically through the health sector. We have been working with partnering through UNICEF and the Power of Nutrition support in terms of strengthening the community-based nutrition through the health extension program, as well as also mobile outreach services. We have been also been implementing a high-impact, low-cost nutrition interventions, including vitamin A supplementation, deworming, WIFAS, and also multiple micronutrient supplementation, as well as also we have been also using an evidence generation for making informed decision making. Beyond the health sector, we have been also working with, for instance, with the social protection sector through the cash transfer, the village saving kind of activities to enhance and leverage the nutrition activities through the nutrition sensitive intervention. So this has been a really critical contribution of our partnership with the Power of Nutrition. Thank you. Maybe we can go ahead to the next question.
Thank you, Dr. Cisse. That's really helpful. And that's where the kind of value add we see with the government leading the agenda and government leading the different sectors coming together and funders and implementing partners supporting the agenda. And Ethiopia has been a sort of a North Star in terms of that kind of an example of how different stakeholders can come together to support the government on their priorities, the evidence-based priorities. So I really wish, we at the Power of Nutrition wish Ethiopia all the more success in the next phase of expansion, and great we are celebrating the 10th year birthday together. That's also quite heartening. So next question is like, can you share your thoughts around the importance of catalytic funding? We heard Terri mention about the match funding. We heard Lisa mention about the concession loan and how that got leveraged. So some thoughts from your side around the importance of such different catalytic financing with government domestic resource allocation to facilitate things to be delivered at scale through the government systems.
Yeah, thank you so much, Dr. Alok. The Sakota Declaration is one of the flagship government initiative, which is owned and financed by the government. In this regard, since the launching of the declaration, the government has been making a treasury budgetary allocation to finance the implementation of the Sakota Declaration roadmap through a costed Warada-based plan that is financed on an annual basis from the federal treasury. So each year, the government allocates a specific amount of resources for the respective Waradas through the costed Warada-based planning, where we plan a high-impact, low-cost interventions. This financing is now being co-financed by also other development partners, including the Power of Nutrition, the Africa Development Bank, as well as also the Human Capital Operation from the World Bank. That is really helping us now to accelerate the implementation of the the government investment. For instance, just to give you an example, last year alone, the government has allocated over 21 million, which is co-financed by the federal government and co-financed by the regional mind. So whatever, 1 birr allocation from the federal government is co-financed by the equal amount from the regional government. So that way, we have made an arrangement of the federal regional co-financing in terms of domestic resource mobilization, but the partners financing, like I said earlier, the Power of Nutrition, the Africa Development Bank, the World Bank Human Capital, really leveraging that effort at country level. Thank you.
And your message is very loud and clear, Dr. Cisse, that in this current funding scenario globally, we need to look at what works and try and not keep on reinventing the wheel as well, but what has worked, what you've tried and tested in few earlier phases of the Secretary Declaration, how can we take it to the scale for the rest of the geographies as well? Thank you so much. This is quite helpful. And over to Shelley.
Yeah, thank you so much, Dr. Cisse. It's really, really heartening to hear everything going on in Ethiopia. And our next panelist we'd like to introduce to you is Natalie Roschnik. Natalie is a senior nutrition advisor with Save the Children, a long-standing partner of the Power of Nutrition. She's technical lead for nutrition programming in non-humanitarian settings. Natalie's a public health nutritionist with an MSc from the London School of Hygiene and Tropical Medicine and over 25 years of experience supporting nutrition and public health programs in Africa and Asia. Natalie is also a doctorate student, there's a lot of them with us, at the Institute of Global Health at the University of Geneva. Natalie, thanks so much for being here. We're really proud of the partnerships that we have with Save the Children and the programs we've been able to deliver. And 2 of those in Indonesia and Malawi have had multiple implementing partners, multiple funding partners, and strong buy-in from the respective government. And we've just heard a little bit about that. But can you share your reflections on how you think these multi-stakeholder partnerships can be complicated, but also can facilitate impact for nutrition, particularly where you've seen that in Indonesia and Malawi?
Yeah, thank you. And thank you so much for inviting me, because I remember the first days of developing the BISA proposal way back. So it's really nice to be here to reflect on these 10 years. Yeah, so I would say, it's been a very interesting experience and valuable experience with Save the Children, because prior to Power of Nutrition, most of our experience was with maybe grant-funded projects with 1 or 2 donors, probably a number of implementing partners, but certainly not as many as we have now in those 2 projects. So just for example, in the BISA project in Indonesia, we have at least 6 donors, and I counted sort of including 2, we had, sorry, because it's closed, but 2 bilaterals, a philanthropist group, a corporate donor, private funding from Save the Children, Korea and South Hong Kong, and all through, some through Nutrition International, our partners, some through Power of Nutrition, some through Save the Children. So yes, there were many donors, and in Malawi, it's 11 donors that we've counted, and probably more because I'm not counting all the ones from our partners. So so while this makes it the project much more challenging, because they have their very different types of donors with different modalities, different agendas, different times as well that they've sort of integrated the project, it did require a lot of effort to sort of, as my Indonesia colleagues put it, was to harmonize the orchestra and get harmony amongst the orchestra. I think we feel that also this pooled funding model was sort of ahead of its time in a way, and with the current funding situation, that this may be more of the future of where we're going. So there is a lot of learning, I think, that we can draw from these parties. We have learned a lot through these 2 projects in terms of how to deliver programs with so many donors and partners. But that saying, there's also some advantages, as much as it's been complicated. I think some of the advantages, and I was talking to our colleagues in Indonesia and Malawi, and one of them in Indonesia, they were saying that having so many partners, it did increase government uptake or visibility of the program, because so many partners are talking about it and discussing it. It's also been a great way to attract more donors, because I think, especially smaller donors, because to be able to say, well, we have this, we have funding for this, this, and this, but we still need funding for this. Do you want to contribute? So I think those have been, the main lessons for us.
Brilliant. I love that about harmonising the orchestra, because from our point of view, that's quite often what it's been feeling like as a convener. But I think where you enable people to all pull together with their skills and their contributions, as it can work beautifully well. And thanks so much for that, Natalie. But just building on that, these two partnerships have worked closely with the governments in country. How have you seen those partnerships work across the continuum of strong evidence to support better policies, to support quality implementation at scale?
Yeah, so this is one of the things we've been really grateful with both projects, is that the research and evidence component has been really strong, and has really been used to influence national policy, but also implementation and how to implement at subnational level. And in Malawi, for example, the Maziko project, which is implemented with Give Directly, with a research IFPRI, which is the International Food Research and Policy Institute. We have a very large cluster randomized trial, and to evaluate the impact and cost effectiveness of maternal child cash transferred with a multi-sectoral plus component. And actually, the end-line is happening right now, so hopefully we'll have results on that coming by the end of the year. But why this is important in that country is that it is one of the most rigorous studies on nutrition-sensitive social protection. And so in Malawi, I mean, and it also comes at a key time as the government has just developed and is starting to plan the rollout or the scale up of a nutrition-sensitive social protection operational framework. And so there's a lot of momentum for this by multiple partners. And so Maziko's playing, has a really important role to play, especially at this stage after 4 years of implementation, to really bring the evidence of not just the impact of the intervention, but also the experience on how to implement this nutrition sensitive social protection framework. And I think an important lesson for us is the importance of bringing the government with us all the way along this research and learning agenda. And also, I think what we've really appreciated with the Power of Nutrition program is the flexibility in being able to adapt as we go along, because the questions come up are different and you need to adapt. So I think that's been just really valuable to us.
Amazing. Thank you so much, Natalie. I think, the theme that it's almost like we planned it, but this theme of the multi-sectoral approach, and examples of how that has really worked in the programs we've done together, but also in Ethiopia, as Dr. Cisse was just talking about. And so that brings us nicely on to our next panel question, which we're going to ask to all members of the panel that we've had so far. And we know that undernutrition is an outcome of multiple deprivations and needs a multi-sectoral approach to make lasting impact. So how has your partnership with the Power of Nutrition supported strengthening of multi-sectoral approaches to address undernutrition? Where have you seen the successes and opportunities? And Terri, can I come to you first?
Yes, thank you, Shelley. And I guess what I should have said earlier in my earlier remarks was, of course, a huge focus of what Power of Nutrition has done and has been doing is sort of supporting partners or particularly government partners to integrate nutrition into their health systems, and that is as relevant now as it's ever been, and it's really important to do that. I think we also realise, and we have done as well, is that integrating nutrition needs to be done not just in the health sector or indeed in the humanitarian sector, but right across in our climate work, in agriculture, food sectors, social protection sectors, education as well. And I think that's particularly relevant in the current context where we see huge declines in government in ODA, overseas development assistance, and what is going to have to be a much bigger contribution from at least relative contribution, the sort of contributions that governments are making, and I think we really need to make sure that we integrate nutrition in as many sectors as possible, but both as donors, but also I think we need to work with governments as well so that they can integrate nutrition right across their policies and programs, not just in the health sector, but in beyond. And I think we know from our own experience in FCDO that we're quite good at it at doing, well, we're pretty good at it integrating in humanitarian sector, quite good in the health sector, but not nearly as good in the climate sector, where very few of our climate programs have integrated nutrition. So I do think it's a big agenda, and of course that was the focus of the Global Compact on Nutrition Integration, which Baroness Chapman launched at the Nutrition for Growth Summit in Paris in March. And I'm pleased to say that 85 countries and organizations, including the Power of Nutrition, are now part of that compact. And we're hoping to work together to support each other and share learning and experience about how we can integrate nutrition right across different sectors and try and achieve the nutrition results that we're all working towards. So it's highly relevant, and we've got a big job on our hands. Over to you, Shelley.
Absolutely. And congratulations on the compact, because I think that has really driven things forward and really shown a leadership in that area. So thank you so much for that. Lisa, same question to you. Where are you seeing multi-sectoral approaches address undernutrition?
Thanks. I think I already mentioned the importance, I think, of longer term investments. And I just want to reiterate that. I think, once you have sort of a core community-based platform or core integration into health, then we've seen the possibilities to start layering in different other sectors, and to do it sequentially. I think I really wanted to mention one more thing about the Power of Nutrition investments, which was, I think that we were able to use that to make sure we built in learning agendas and really a focus on evidence. And I think to Terri's point, I mean, the importance of making sure that the investments within each sector are the most evidence-based and high impact, and the absolute essential nature of this right now, when we don't have much financing. It's really important to build in the layering of the learning agenda and making sure that what we're investing in works. And I think that really applies with multiple sectors, because it's easy to kind of lose track of how each piece is really contributing to the overall picture. I think, in terms of what Power of Nutrition was able to do, I think Rwanda is a great example, because the government had really led and had a commitment to eliminate stunting. And the Power of Nutrition, with other partners, was able to respond with 40 million, I think. There was a co-investment with the government, with the World Bank, with Global Financing Facility. I think the Power of Nutrition also brought in support from bilateral donors, including FCDO and other foundations and the private sector. So all of that crowding in of financing, I think, ended up also unlocking, I think, over 120 million in World Bank IDA financing from health, from social protection, directly focused on multi-sectoral nutrition and in convergence of these different approaches. I think that very clear overlay allowed the cash transfer programs to become more nutrition, more child sensitive. They were able to digitize and integrate the systems. They had interoperability between them. They were able to strengthen local planning. And I say all this to say, this was a massive effort. Once all of that happened, I think the government then insisted that the World Bank investments in agriculture should also converge. And so you were able to really see that with TA, partially financed from the Power of Nutrition, but from many other donors, focused on the same packages and the same areas and the same outcomes. They could look at adding a scorecard, including budget tagging and tracking. So all of those pieces together, I think, take time and take a lot of donors focusing on the same efforts. And I think it really showed what was possible. I think political commitment and coordination is essential, and it has to come from the government, to ensure that you do get all of these pieces together.
Yeah, so much in what you've just said there, Lisa, in terms of data-driven, evidence and impact and learning and how we build on that and partnerships, all very much at the heart of what we've tried to champion for 10 years. So thank you very much for those highlights there. Dr. Cisse, we'd love to hear from you, your experience of supporting strengthening of multi-sectoral approaches. You've touched on it a bit with Ethiopia, but please do come in with your thoughts.
Thank you so much, Shelley. Just to give few examples from Ethiopia, the first one is, I think, the partnership with Power of Nutrition in terms of the multi-sectoral data system, and also multi-sectoral strengthening multi-sectoral accountability is the food and nutrition strategy baseline that we conducted through EPHI. This is a multi-stakeholder, multi-sectoral, very large-scale country-led baseline. That is a very good example for the evidence generation, which we also used it to set the baseline for the Sakota Declaration expansion phase. The second good example is the multi-sectoral unified nutrition information system for Ethiopia, which the Sakota Declaration is using to track the performance of each sector at national, subnational, and district level, which we present that using a scorecard for the leadership to make a course corrective decision. And also we are using the UNIS data set to make the annual outcome monitoring of the Sakota Declaration using the list methodology. The third and the final work that we used in terms of multi-sectoral data generation is the public financing for nutrition. As you know, we need to understand how much investment is going to nutrition through the various sectors. And with the leadership of Ministry of Finance, jointly with UNICEF, we have set up a budget tagging and tracking system. That system is now enabling us to track how much investment is going to nutrition, direct nutrition, or indirect nutrition through the health sector, agriculture, water, social protection, and also women and social affairs sectors, and also education, and also to know that how much investment is going to nutrition. So I think having such kind of partnership with the Power of Nutrition to strengthen the multi-sectoral approach specifically to generate an evidence base to make informed decision, both from financing perspective as well as also programmatic perspective is key to make an informed decision making. Thank you.
No, thank you so much, Dr. Cisse. That evidence-based course correcting decision making is so important, isn't it? So yeah, thank you for bringing that out. And Natalie, finally to you.
Yeah, thank you. So yeah, I think for us, from our side, from the implementation side, I think what we found, and definitely in these two countries, is that generally the governments in those two countries recognize the need for a multi-sectoral approach, and they have strong policies and strategies to support that effort. However, how to effectively implement it on the ground is less obvious. And we found that these two projects really played an important role in finding the best ways to localize these national policies and strategies and seeing how that works at the provincial, district, village level. So, and just to give you an example, again, going just back to the nutrition sensitive social protection operational framework in Malawi, which just is quite new still, but they recommend a lot of plus interventions to go with cash transfers. So they include social behavior change, livelihood and agriculture, school nutrition, financial services, family planning, WASH, and health and nutrition services. So it's a lot actually to implement alongside the cash. And of course, it costs a lot of money. But most of these interventions, we were pleased to actually, when we went through our Maziko plus interventions, we were ticking a lot of the boxes. But despite that, and despite the fact that, we did have a strong inception period where we identified the key drivers of malnutrition, tried to really focus where it was most important to include the plus interventions, we still find this multi-sectoral plus to going with cash transfers quite heavy for scale up. And so there's like now a unique experience with Maziko, because we've been implementing these interventions for 4 years or whatever. To really identify the opportunities to be better integrate and mainstream, and cut down a little bit, and not cut down on the sectors, but cut down within, either on the content or on the operational modalities or things like that. So and to identify a sort of minimum plus package for the social protection sector to make sure that it has an impact on maternal child nutrition.
Yeah, thank you so much, Natalie. And I think that sort of learning from these different interventions and what's working well in different countries is so important, isn't it? How we find the way to share that learning across the sector and to build on it. Thank you so much. We're going to move our panel on now to look at some of the insights that we gained across 10 years by working with Modern Scientists Global. I'm going to hand over to Alok here to introduce Hannah.
Thanks, Shelley. Hi, Hannah. Welcome to the panel discussion. And Hannah is a public health scientist and research manager at Modern Scientists Global. We have had multiple engagements with Modern Scientists Global. Hannah was part of the earlier work that we did with MSG, which was around the cost of stunting report, which got published in Lancet in 2021. And now she has been sort of the force behind the entire list modeling and all the numbers that you all saw at the start of the presentation. And she has a background in global public health research with an emphasis on maternal, child, newborn health and nutrition. She's a public health scientist and research manager at Modern Scientists Global. And her expertise in analyzing quantitative data, including large-scale household survey data, such as DHS and mixed data. So first of all, massive thanks from everyone at the Power of Nutrition to Modern Scientists Global entire team, and Hannah, to you, Nadia, and everyone in terms of helping us see what the Power of Nutrition, through all the partnership, through all the funding, through all the programming, through all the interventions, what exactly does it translate to? And some of the numbers we showcased very early on in our webinar today was speaking around those things. But what we would request you to kind of now share with everyone in the audience is some of the key highlights that came out in terms of the recommendation for the sector.
Sure, thank you. Thank you, Alok. Thank you for that introduction. So yes, I'll be presenting on the 10 lessons and recommendations that came out of our work that was looking at the past decade of the Power of Nutrition's progress. So to give you a little bit of background, we at Modern Scientists Global undertook an evaluation of the programmatic impact, the partnerships, investments, and looking at the strategic shifts that have happened over time. And specifically, we wanted to understand key stakeholder perspectives around reach and impact that has been achieved over the past 10 years. We wanted to evaluate the total new funds raised for nutrition, to look at the co-financing and the innovative financing approaches used by Power of Nutrition. And then finally, we wanted to estimate the impact of all of the programming since inception on key maternal and child nutrition and mortality outcomes, and some longer-term economic and empowerment outcomes for children. So our evaluation used a mixed methods approach, including qualitative data collection and analysis, quantitative modeling, so that was the list modeling, reviewing of existing evidence, and financial analyses. So we used contribution analysis as our overarching evaluation method. It provided us with a systematic approach to understand the contribution of programs and interventions and how they've made contributions to observed results. And then the first thing that we did was in evidence review, and we looked at all of Power Nutrition's previous evaluations and strategies and other relevant documents, and so we incorporated that in our work. We also undertook qualitative data collection and analysis. So 21 individuals were interviewed in a series of 15 interviews. So some were group, some were individual, and that happened at the end of last year. And that included Power of Nutrition staff, implementing partners, donors, and country stakeholders. And we wanted to understand key stakeholder perspectives around reach and impact regarding delivering nutrition at scale, effective collaboration, including multi-sectoral approaches, program sustainability, raising the profile of nutrition, mobilizing funds for nutrition. And then we also looked at financials. So we conducted financial analyses and we looked at some key performance indicators. So we looked at fundraising performance, leverage rate calculation, which allowed us to evaluate the effectiveness of the matching model and how donor contributions were amplified. We looked at expenditure efficiency and operational efficiency. And then lastly, we used the LiveSave tool. This is a tool that estimates the impact of scaling up maternal, newborn, and child health and nutrition interventions in LMICs. And we used it to quantify the impact of Power of Nutrition's programs from the time of inception. And then we aggregated those findings to show differences in impact over time and by country and by intervention and implementing partner. And so for that, we worked really closely with the Johns Hopkins University LIST team, and we were able to model outcomes of interest for all the programs that had sufficient data. And the outcomes of interest that we were able to model were some of the ones that Alok had presented. So neonatal lives saved, child lives saved, child stenting years averted, maternal anemia cases averted, years of schooling obtained, and the present value of lifetime earnings obtained by a birth cohort, and that's as a result of a reduction in stunting. So based on those results that we obtained from our mixed methods approach, the findings are presented in the impact report and also in an associated manuscript that we hope to publish this year. So on this slide, you'll see the set of 10 recommendations that came out of our work. So the first lesson and recommendation is to prioritize multi-sectoral collaboration for greater impact. So in our evaluation, stakeholders across groups cited the value of cross-sectoral partnerships in addressing the drivers of malnutrition, as well as underserved populations that lack access to many critical services such as WASH, so water, sanitation, and hygiene, immunization, early childhood development, to advance the health and well-being of vulnerable populations and to promote lasting impact. The next recommendation is to strengthen health systems and build local capacity. So we found that the Power of Nutrition's investments advance sustainability by building local capacity and not only ensuring the sustainability of programs going forward, but also promoting domestic resource allocation toward further programming. So we found Maharashtra as an example of that. So the government used their own resources to scale up early childhood development programs across the state as a result of Power of Nutrition initiated program. And that had significant implications in terms of learning and evidence generation for program development at a national level, so not just at the state level. The third lesson is to leverage multilateral development bank financing at scale. So many stakeholders noted that the Power of Nutrition's ability to develop and scale large programs with credible institutions such as the World Bank was one of their greatest assets and should be a critical learning priority for the development sector overall. This takes years to build and establish these platforms and relationships. And there is a great political influence, impact, and reach garnered with such partnerships. And it's important to scale up programs and positively impact those health outcomes with those large-scale programs. The next lesson is to strengthen domestic resource allocation for ownership and sustainability. So this could entail allocating program costs to program budgets during proposal development, studying results-based financing models, investing in a larger fundraising team, and exploring expansion to markets with more development funding opportunities. Fifth, mobilize private sector capital for sustainable nutrition solutions. So some stakeholders indicated that the Power of Nutrition's funding model used for private sector institutions was not really well suited to the private sector, as it did not allow for donors to test small scale donations in shorter term projects that delivered relatively quick results. And that's what some of the private sector donors were looking for. So perhaps development partners should consider projects that allow them to build long-term relationships with donors that facilitate these repeat and larger scale donations from the private sector, maybe experimenting with something smaller or shorter term that could show those results that they're looking for in the short term. So next, adopting innovative financing models to close the funding gap. So the Power of Nutrition has pioneered an innovative co-financing model that enables donors to multiply their investments fourfold, as we've heard. In evaluating the past decade of the Power of Nutrition's work, we can see that the matched funding model worked well to mobilize and leverage funding for nutrition, which in turn led to reductions in child mortality and stunting and improvements in maternal and child nutrition. So we see that works, and innovative financing models are really needed now more than ever in the nutrition space. So the 7th lesson is to amplify knowledge sharing and advocacy to sustain momentum. The Power of Nutrition had a significant role in raising the priority of nutrition at the implementing partner, donor, and country level through its investment, technical support, knowledge mobilization, and advocacy. And stakeholders that we spoke to had noted that one of the greatest value adds of Power of Nutrition was the ability to keep nutrition on the agenda in larger programs, as well as the positive impact of the Power of Nutrition's research and knowledge sharing efforts on advocacy and promoting buy-in at the government level. So this is a really important piece as well. Next, we found more robust and reliable data are crucial to supporting effective implementation and securing more funding. So as noted by key informants, systems strengthening initiatives are really an integral part of the Power of Nutrition's programmatic work. But what we found when we used the list analyses, we couldn't directly model these health system strengthening activities, and we instead relied on attendant changes in modeling intervention coverage to assess the impact on maternal and child outcomes. And this might miss some of the impacts or some of the ones that would come longer term. So being able to measure directly health system strengthening impacts could not only support organizations like Power of Nutrition to accurately communicate their impact, but also it could promote greater political will and buy-in to support those interventions as well. Next, a targeted convening body is vital to mobilize and leverage resources and expertise. So the stakeholders we spoke to noted that there was large value in having an organization that could bring various entities to the table. And within this convening role, development partners need to ensure that there's a strong communication and engagement between all partners, and that expectations are clarified both at the beginning and throughout the partnership. And strengthening these relationships with existing donors and promoting engagement with new donors, especially in the current challenging funding climate, needs to be a foremost priority. And then finally, 10th, platform funding to deliver matched funding can incentivize funding at scale. So the Power of Nutrition's founding objectives included mobilizing and leveraging funding to deliver nutrition at scale through high impact interventions. And previous evaluations found that many large-scale programs either would not have happened without Power of Nutrition support, or they would have happened with a reduced focus on nutrition. And we also found that to be the case. We found that nearly all implementing partners reported that the Power of Nutrition had an important role in catalyzing investments for nutrition. And also the Power of Nutrition had success in mobilizing funds and had a catalytic role. And they were able to pool funds for nutrition and demonstrated an ability to leverage that match funding as an incentive for donors. So this could be a way to get more funding to nutrition where it's really needed. So thank you. Those are the 10 lessons and recommendations that came out of our work.
Thank you so much, Anna. And thanks for MSG again to bring out what worked well and what were the kind of the things that could be done better, because that's what a lot of insights that came from different stakeholders in terms of this worked well, this could have been done better. And I think all of those are being captured in the impact report. And also, as Hannah said, the manuscript is in the process right now. So we are looking at a publication around this in the times to come, and there are some other manuscripts that will come out of the learning series as well in the months to come going ahead. Thank you so much, Anna. This has been kind of the backbone of the learning and impact series for us at the Power of Nutrition. Over to you, Shelley.
Yeah, thanks so much, Hannah. It's been great to have your partnership and justify what we've been doing. So I'm just going to finish off, as we've got the last few moments of our time together, I have a rapid fire question that I'm going to ask all of our panel that have been with us so far. And the question is, what's the most critical aspect for the nutrition sector going forward based on what we've heard today? So we've covered a lot, so that might be a challenge, but what's the one thing that you would pull out, your one key message for the audience today? And Terri, you were first back on my screen there. So what would you say is the one key message from you?
Well, I think it is we must, as a community who cares about ending malnutrition, continue to find new partners to work with. And as I said right at the beginning, Power of Nutrition has done that very well with new donors, but we now need to find new partners in new sectors so that we can integrate nutrition, achieving nutrition objectives right across everything that we do. Thanks. Back over to you.
SDG 17, all about partnership, so very critical. Thanks, Terri. Lisa, coming to you next.
Yeah, I think the World Bank recently updated the investment framework for nutrition, and it estimated an additional, I think, 13 billion per year needed to scale up evidence-based interventions. And so, echoing Terri, it's really to understand, given this huge declines in available financing, how can donors improve their coordination and pool their support around a package and really integrate that into existing investments? And then I think if I can have a second point, it's just that we have to really keep focusing on scale, like getting evidence-based interventions to scale. Thanks.
Yeah, absolutely. That scale is so important and justified. And Natalie? Oh, sorry, I've missed out Dr. Cisse. Sorry, I'm going to come to Dr. Cisse next. Sorry, Natalie.
Yeah, thank you so much, Shelley. I think for me, we need to have a new way of thinking in terms of financing, specifically a country-led financing, and also the donors to match the local and domestic investment. I think the good example is the Quota Declaration. We have the country investment, and if the government, other donors could co-finance the local domestic treasury investment, that will really leverage the impact at scale. Thank you.
Yeah, 100%. Thank you so much, Dr. Cisse. And Natalie, finally to you.
Yeah, and I'm sort of changing it as I hear everybody else. But I do think like it's again around the funding for nutrition. And I think, all of these 10 years experience of working with very diverse types of donors is incredibly valuable, and I think is incredibly valuable for so many partners like Save the Children, that I feel like would be also for national, local NGOs or civil society governments, I'm not sure, on how to make that work well. I think would be really valuable. And I know that just from the Save the Children global ventures that there is a lot of money out there that can be leveraged for nutrition, but finding how to do it is a challenge, I think. Yeah.
Brilliant. Thank you so much, Natalie. Over to Alok, who's going to wrap up our time together.
Thank you so much, everyone. So for me, when I look at all that was discussed in last, how much, 75 minutes, three things again comes to the top. A challenging funding environment currently, which is what we heard. We heard that in WHA last week. We heard it during the N4G the month before. And that's something which everyone is grappling with. And today we heard different people on the panel talking about pool financing, match financing, leveraging domestic resource allocation, government-led fund financing, leveraging the concessional loans, as well as the private sector funding to be leveraged. So this is what I feel we as an ecosystem of stakeholders around nutrition can look at from the catalytic financing perspective, because nutrition has been an underfunded. Lisa mentioned the need and the requirement with the new numbers coming in, whereas we are falling short in terms of those funding numbers, and there are the need and there are these opportunities. And there has been examples of so many ways of leveraging the catalytic financing. So that's my number one takeaway, the catalytic financing component. The second I would say is nutrition always comes across a very fragmented sector, and there are different priorities. We started as an organization focused on stunting. We evolved and we started looking at all forms of malnutrition, but the funding remains quite fragmented, and same funding pot, different stakeholders are running behind. So I think, Natalie, what you mentioned about harmonizing the orchestra, I think that's great, and it aligns with what Dr. Cisse was saying about it has to be country-led. It has to be having localization as a key aspect upfront. And then donors, implementing partners, different stakeholders, research agencies, they all supporting these evidence-based interventions and programs to go to the word Lisa mentioned, scale. I think that's important, and scale can be achieved if delivered through the systems approach, as we talked about different country examples in our partnerships. And I think third and most important component along with that is the fact that nutrition is an outcome of multiple deprivations. And the compact that Terri talked about is something that we are really, we feel that we have at the Power of Nutrition lived that across multiple years, and it has become more and more as a priority for the Power of Nutrition to have multi-sectoral programming. And most of our investments across 26 programs are multi-sectoral in their approach. Lisha mentioned about those at the World Bank programs. Natalie mentioned about with the Save the Children. And similarly, we have multiple such multi-sectoral programs with other implementing partners like UNICEF and others as well. So when we look at this entire ecosystem, I think the multi-sectoral approach is important. We have example through our partnerships. We have example of what FCDO has been able to leverage and rally the different stakeholders around. So that becomes a key important one if we have to achieve the WHO targets in the next 5 years, the extended target timeline. So those are the three key takeaways. And I would also want to kind of, share the fact that there would be multiple manuscripts coming out. There has been impact report that has been shared. There would be, there has been fireside chats with key stakeholders, bringing out examples from key programs, key insights, key partnerships. Those have been, are there. This webinar would be shared as a recording with all the stakeholders. We have story maps of our partnership with World Bank, our partnership with UNICEF, and our partnership with different INGO partners. So all these are there, and we would be keep on sharing as these things come across. And many publications are in the pipeline, and they'll come over the coming few months, and that would also be shared with the sector. And our whole focus was not to just talk about what worked, but how it worked, and in terms of what could be done better. So wanting to leave all these insights for all the stakeholders to also think about, look at, and see that if there is something that could be done without reinventing the wheel, how best can we do that component. And last but not the least, I would like to thank everyone, starting with all our panelists today. It was amazing. Thank you so much for being part of this important webinar for us, for giving you valuable time and the insights. It has been a pleasure. All the audience that were there on the panel discussion, all the partners, the government stakeholders, the funding partners, the implementing partners, the research partners like MSG, who have done the lion's share of our learning series outcome that has come out right now. And last but not the least, the Power of Nutrition team, the past, present, and future, everyone who has worked at the Power of Nutrition in the past who are not there. It was their legacy, what they created. We have been taking it ahead. We have been working on those initial foundation stones that were created, and it will be taken ahead for the rest of the programs that are in the future. So thank you so much. And yeah, we are 3 minutes beyond time, but I think birthday celebrations are never kind of ending on time. There are sometimes over celebration that happens. So yeah, we'll share the recording of the session with everyone. Thank you so much. Thank you, everyone.
Thank you, everyone. Take care.